So we have now 333 confirmed and probable cases in the Ebola outbreak in North Kivu province in the Democratic Republic of Congo, and more than 200 deaths.
I think they have headphones on. Plus we need to look a little bit serious.
It's very hard to predict timeframes in an outbreak as complicated as this, with so many variables that are outside our control. But certainly we're planning on at least another 6 months before we could declare this outbreak over, and that will change and vary as we get more information on a daily basis.
Just how is it playing with, we know that in this region there is a lot of...
The context for this outbreak is arguably the most difficult context that we've ever encountered, due to what I've called a perfect storm of events in that part of DRC. We have a highly mobile, highly dense population. We have huge ongoing insecurity with two particular armed opposition groups that are really very active in this area, the Mai Mai and the ADF. And of course we have this outbreak which has been really amplified by transmission in healthcare facilities that's ongoing. So it's a very complex context for the response, but we believe that we have both the traditional and the new response measures in place to over time contain this outbreak.
People obviously go to the more...
This time around I really understood how complex the nature of the healthcare transmission is in North Kivu. So there are several hundred what they call tradi-modern or traditional modern health facilities in Beni. They have never been mapped, they're not regulated by the Ministry of Health, they're private facilities that are really business ventures. And those facilities are, we believe, one of the major drivers of the ongoing transmission. Probably more than 50% of cases in Beni have been driven from these tradi-modern healthcare facilities, and the fact that hygiene and injection practices in these areas are relatively unsafe.
Did you know any of the other people who were...
Julian Harness.
DG, that's you, Sose, okay. And
so since we recognize that phenomenon, we've really ramped up very significantly our program known as IPC, Infection Prevention and Control. And that involves safe water and sanitation, hand washing. It involves triage facilities. So if there is a suspected case of Ebola, we are able to triage quickly. It involves equipment for safe injection practices, training of the health technicians or the people who are working in those healthcare facilities, and putting them on high alert with the phone numbers that they can call immediately if they do suspect a case of Ebola.
I think they have headphones on. Plus we need to look a little bit serious.
So indeed, it's very likely that there's some cases of Ebola that have been misdiagnosed as malaria, because the symptoms, initially at least, are virtually identical. And it's also very possible that you had people who were in beds next to Ebola patients that were undiagnosed, that were exposed to Ebola, unfortunately, in that way.